you will be the Targaryen in your clinic. So that always be careful for this thing. And or do you know what? Just try to turn on the turbine for about 1 minute and turn off the cooling, the water supply for it, and then touch it and see how hot it is. So that is very important to notice this thing. The third group of factors are the chemical factors, and in general, composite is not so harmful to the tooth, but again, we cannot absolve the inorganic filler metals in it like lithium, barium, strontium, aluminum silicate, and any other metal in it. They might, in direct or indirect way, affect the pulpal health and lead to pulpitis. And also, the peroxide initiator that is present in the composite is an irritating factor and might lead to um, pulpitis, because as you know that the peroxides are strong chemicals and irritating chemicals. And I think this is true because so many patients, after doing a composite restoration for them, they come to you and tell you that there is a sensitivity in their teeth. And when you remember the procedure, you have done everything right, you have used a cooling system during the preparation, you didn't leave any acid etchant there. So that what is the cause of this? I think that the composite restoration is a factor that may lead to pulpitis. And of course, the mercury and the other metals that are present in the amalgam restoration are, the mercury is toxic, and of course it may be toxic to the pulpal tissues and may lead to pulpitis in them. And the acid etchant is a phosphoric acid, and as we said before, acids eat everything and irritate everything, so that of course it will irritate the pulp and lead to pulpitis. The cements and luting agents, all of them cannot be absolved from doing some pulpitis. Guys, when I say, or when I am saying that these chemicals might lead to pulpitis, I don't mean that they will lead to pulpitis and then irreversible pulpitis and then pulpal necrosis. No, I mean that they may have some effect on the pulpal health and integrity and may lead to pulpitis. And the liners like the calcium hydroxide. The calcium hydroxide, basically, it is an irritant chemical, and because of its high pH, it will irritate the odontoblastis and will initiate the formation of the dentinal bridge. Okay, guys, so that it is an irritant. Basically, the mechanism of its action is irritation. So that because it does irritate the odontoblastis, it will not irritate the other cells in the pulp. No, of course it will irritate them and may lead to pulpitis. And of course the bleaching products and the carbamide peroxide, and after dissociation and formation of hydrogen peroxide, of course it will lead to pulpitis, and the patient feels that directly because they are strong chemicals and will irritate the pulp. And finally, the pulpotomy pastes and the aldehyde chemicals the aldehydes are the group of chemicals of the organic chemicals that we have studied in organic chemistry, and the formaldehydes and the formocresol. The aldehydes make the formaldehyde, and the formaldehyde makes the formocresol. And the formocresol is a chemical that we use it so much in the pulpotomy procedures for peds and also adults sometimes. Uh, it is an irritant, it is a strong chemical, and it does a caustic effect to the pulpal tissues. And because it does a caustic effect, it will not lead to pulpitis? No, of course it will lead to pulpitis. So that, guys, you should know that uh, these factors might combine together. For example, in the case of the cracked teeth, in the cracked tooth syndrome, the the physical factors, I mean here the trauma that happens, the vibration that happens, the fracture that happens in the tooth, of course will lead to the inflammation of the pulp, and the subsequent ingress of bacteria will lead to pulpal inflammation or pulpitis. So that when we have the pulpitis, the first thing to happen is a moderate amount of pulpitis, then it will progress and be irreversible pulpitis, and after being irreversible it will progress and progress and progress until there will be a huge amount of irreversible inflammation in the pulp that will lead to pulpal death, or as we call it as pulpal necrosis. This was the summary of the factors that lead to the most common disease of the pulp, which is the inflammation of the pulp or pulpitis. Thank you for listening to this presentation. Always try to know, always try to spread knowledge and construct the world. Always try to be kind to others, because life is not short, but it is limited, and that is for the greatest benefit to the humankind.